Making telemedicine work in Nigeria requires every stakeholder to come together in a team, particularly at the highest level, government, the non-governmental organizations, the academicians, the practitioners, the telcos, the telecommunications industries, the regulators in the high city and the health sectors, and rub minds together collaboratively to ensure that telemedicine and e-health develops. Without a high level of collaboration at all levels of all stakeholders, we keep reinventing the wheel. We keep having projects that might not really stand the test of time, that are unscalable, and then we'll still have handed hope in achieving what telemedicine e-health will have achieved for us. So it's very critical to have coordination for it to really benefit the general public at the national level. That is, the ministries of health, the ministries of communications technology must work together to have a coordinating mechanism. With that in view, and designing a strategy within view of the end users in mind, we will have a successful implementation in Nigeria.
Now, for most Nigerians, the use of telemedicine or e-health is practically non-existent, with many patients preferring to use the traditional methods of getting health services. What challenges does the country face in administering telemedicine and e-health, especially in light of the level of computer literacy in the country?
The challenges we have, one, is that because we have how will I put it? We have overemphasized those challenges. Nobody thought we could use mobile phones in Nigeria, but today Nigeria happens to be the largest user of GSM, third largest in the world and largest market in Africa. These are made possible because regulations came, strategies and policy came, and then the investors came in. Likewise in e-health, we already have the tools. E-health is just a generic adaptation of e-commerce. Today we can bank from our home, from schools, from nurses, so it's the same technology. It's all it needs to be organized and mainstream into the mid-end system, that is, into the fabrics of the health system. So it's not a new way of providing health care, it's just a tool that is used to provide existing services. And for the end users who are not literate, even we know we have limited and shortages of healthcare workforce in Nigeria, but if we connect the few we have to the few specialists across the nations and those outside Nigeria, particularly the diaspora, they can be given free consultation over a medium. We all do chat, we all do Skype, and then we all do emails. It's as basic as simple like that, the technology. So for me, there's no challenge, but the challenge is really starting and the fear of whether we'll be successful with it.
As is with many services dependent on telecommunications, how affordable is e-health to the average Nigerian?
In terms of affordability, of course, we know technology investment is capital intensive. For it to be affordable to Nigeria, there's a need for collaborations. Definitely, services have to be paid for. Investments are made, there must be return on investment. But I tell you, there's no other gain. What this technology does is it bridges the gap to access, and then it ensures there's access to quality, because that is what every innovation in healthcare is all about. So with that, in terms of benefits to the patient, it also outweighs the investment. So, and there's what we call evaluation of health technology information system. You have to look at how does it optimize for the benefits of the patient in terms of the patient outcome and the quality after using it, the cost. How does it compare to when it travels from that distance, the time he used not attending to a farm? So a lot of assessment needs to be done. And we've quite have some projects, but it needs to be evaluated socially, socio-economically, to actually see what is the gain and the impact. And until that is done, it will just be a postulate about the benefits. There are benefits, no doubt, but it must be proven scientifically, evidence-based, that it works.
Can you take us through the business of telemedicine and e-health and how economically viable you think it is to a country like Nigeria?
First, it is viable if e-commerce is viable. And like I told you, it's just an adaptation of e-commerce. We all bank from homes, we have mobile platforms, we have mobile money payment terms, and we have web access. Out of 150 million Nigerians, over 50 million are internet users. We have a higher penetration of internet and computer usage before now than a decade ago. So let's start with those who are already connected, and gradually by voice, Just simple voice. Everywhere we can provide services for those in the village. And mind you, my grandparents or grandparents in the village and yours, they know better. They use mobile phones. They can store images on their Nokia phone, but they've also pre-recorded in their the images for each name. So when they want to call me on you, they know which image they've attached to you. So they might look, have not gone to the four wall of school, but they are still literate to use these tools. That's why it must be user-friendly. If it is going to be economical, it must have features that if you have just primary 6 education, you can access and make use of this system. Then it is sustainable. Of course, it has to be an integration of both a lot of databases, centralized, web-based services, simple SMS to remind you of your appointment, SMS to remind you about your drugs and medication from a clinic. Those are all ways, if you look at it from the perspective of public health. The key thing is ignorance is the bane of disease and death. So through SMS campaign alone, through MMS or simple voice, you can educate the populace. You can educate in our local languages. And that alone will make the investors to derive their benefits. And the truth is, we need a real human-face telemedicine project in Nigeria that is actually sustainable.